Throughout the course of your child's treatment, they'll need to undergo a number of medical procedures. This short video introduces ways you can help your child manage their medical procedures and procedural pain and promote their own natural coping. Here are some suggestions on how you can support your child or adolescent during a medical procedure. Being there whenever possible. Having a parent or special person present will help your child feel more secure. Being calm. A calm presence in the treatment room is reassuring for your child and can help reduce anxiety. Being honest. Providing your child with simple, accurate information about the procedure. Being positive. Identifying small achievements such as sitting still or settling quickly after the procedure is finished can build your child's coping responses. Being creative. Think about what your child enjoys and find ways that you can use this in the treatment room. Being curious. Talking to your child after a procedure can provide useful information to aid in future treatments. For example, what was helpful or unhelpful. Being an advocate. You may find techniques that work well for your child during procedures which could assist their treating team. Please share these with us. As a parent or caregiver, you can play an important role in preparing your child or adolescent for procedures. Whenever possible, ask staff to explain what will be happening so you can help your child or adolescent get ready for a procedure. When preparing your child, consider the following questions when explaining medical procedures, machines, or treatment. Provide clear and honest information about the procedure and encourage your child to ask questions such as, what is it? Where does it go? How does it feel? What is the purpose? For example, a stethoscope would go on your back or chest. It may feel a little cold, and it helps the nurse to listen to your heartbeat. The timing of when you explain the procedure to your child will depend on their level of development and their degree of anxiety. For younger or more anxious children, preparing them only the day before or the day of the procedure may work best. Children may vary in the amount of information they want to know about a procedure. Speak to your child and find out what and how much information they find helpful. Listen and respond to what the child is telling you. Ask if your child has any questions and make it clear that you're prepared to answer them. Use silence effectively to give your child or adolescent time and space to communicate with you. Try not to assume. Help your child to describe for you what it feels like for them. During a procedure, it is helpful to act as your child's coach by encouraging them, using humour, or telling a story that is unrelated to the procedure. Some strategies you might try include empowering your child to explain their feelings. Instead of saying, "This is going to feel like a bee sting," try saying, "Tell me how it feels." This will give your child or adolescent a chance to learn to express their feelings and work out for themselves what is going on for them. Using humour. Instead of saying, "I'm sorry you have to do this," try saying, "I heard a great joke the other day." This is really effective as a distraction technique and to get your child or adolescent to focus on something else. Caregiver as coach. Instead of saying, "I promise you will be fine," try saying, "Sometimes it helps me to breathe deeply when I feel nervous." This is a useful way of being able to remind your child or adolescent of the skills that they have to help them cope. Coping and distraction. Instead of saying, "Be a big boy or girl," try saying, "When I count to 3, take a deep breath." This breathing exercise works well as both a distraction and teaching new coping skills. Positioning for comfort. With a little creativity, the way you and your child are positioned during a procedure can help promote positive coping. It may be comfortable and supportive for your child to sit on your lap facing forward with your arms around their torso, providing a hugging hold. Or it may work well for your child to sit facing you with their legs straddled on either side, with you again providing a safe, supportive, hugging hold. The staff in the Cancer Centre are happy to work with you to find a position that works best for you and your child, provided it is safe for all involved. Feel free to discuss positioning with your nurse or Comfort First clinician. Breathing for comfort. Encouraging deep breathing can have a calming effect on your child's nervous system and is easy to learn. There are a number of ways that you can do this. Blowing bubbles or windmills can help to calm your child's breathing. Practice taking large, slow breaths from the belly. Birthday candles. Have your child imagine each of your fingertips as candles and ask them to slowly blow them out one by one. Belly breathing. Have your child sit or lie in a comfortable position. Encourage deep, slow breaths in through the nose, their hand rising as the stomach inflates and then out as the hand lowers. Repeat at least 10 breaths for stress reduction and a sense of calm. This approach can also be used with guided imagery or counting. Distraction is one way of helping your child cope with painful or difficult procedures. Distraction works by providing a different focus from the procedure itself. Depending on the age and developmental stage of your child or adolescent, there are different methods that you can try. For a baby, you may want to swaddle your child. You can use a rattle or shaker for a sound distraction. You can also use a dummy or breastfeed your baby. You may also like to ask the nurse for some sucrose, which is a sweet solution taken orally that has been shown to reduce pain in infants. For a toddler, comfort items such as a blanket or favourite toy are useful. Other helpful techniques include blowing bubbles, singing and music, and pop-up books. For preschool and school-aged children, you could use textured toys or squishy balls for them to play with. I Spy and Where's Wally books are useful, as are handheld computer games. You can also use non-procedural talk, choosing topics or recent events that are exciting and enjoyable for your child to talk about. Young children can also use breathing and relaxation exercises. Distractions used for adolescents include breathing and relaxation, computer games, DVDs or iPads, and conversation starters or quizzes. If you would like any help in using or teaching breathing and relaxation exercises, please talk to your Comfort First clinician. Generally, it is most helpful to try only 1 or 2 techniques during a procedure. Also, it is important to note that distraction therapy does not work for every child. Some children may prefer to watch the procedure and be involved in what is happening. Guided imagery. Guided imagery is thinking in pictures, images and sensations and can be used to provide a safe, comfortable inner place to leave pain and discomfort behind or to alter the experience of the discomfort itself. Help your child create an imagery experience by inviting them to imagine a favourite activity, place, story or person. Encourage your child to engage in imagery by sensory questions. For example, what they can see, hear, touch and smell. What are they doing? How do they feel? Listen and engage with your child in their imagery rather than making suggestions. Allow the imagery to be your child's choice. Your Comfort First clinician can help you with using imagery with your child. Thank you for taking the time to watch this short video. If you have any questions, would like to talk to someone about your child's procedures or the Comfort First program, please contact a Comfort First clinician.